Bismillahirrahmanirrahim. We shall explain you today about the chemical composition of cerebrospinal fluid and the changes in the chemical composition of cerebrospinal fluid in diseased states. In this context, the objectives of today's lecture are: we shall explain you today what is CSF, how is cerebrospinal fluid formed, where is cerebrospinal fluid formed, what is the composition of cerebrospinal fluid, what are the functions of cerebrospinal fluid, where from the sample of cerebrospinal fluid is collected, and in the end we will explain you the analysis of cerebrospinal fluid as a tool for diagnosis of the diseases. So in this context, what is cerebrospinal fluid? Cerebrospinal fluid is actually extracellular fluid. Fluid compartments are divided as intracellular compartments and extracellular compartments. Extracellular compartments are further divided as vascular compartment, interstitial compartment, and the closed spaces. The closed spaces include ventricles of brain, subarachnoid, subdural, aqueous humor, vitreous humor, subpericardial space, subpleural space. So cerebrospinal fluid, it is extracellular fluid because it is contained in the ventricles of the brain. Therefore, cerebrospinal fluid is an extracellular fluid. In this context, cerebrospinal fluid is actually a clear, colorless, transparent tissue fluid which is ultrafiltrate of plasma contained within the ventricles of the brain and in the subarachnoid space and is present in the spinal canal. Adult cerebrospinal fluid volume is estimated to be 150 ml with a distribution of about 125 ml of CSF is present in the subarachnoid space and 25 ml is present in the ventricles. In adults, daily secretion of cerebrospinal fluid is from 400 ml to 600 ml. The constant secretion of cerebrospinal fluid contributes to complete renewal of cerebrospinal fluid for 4 to 5 times during 24-hour periods in the young adults. The reduction of secretion of cerebrospinal fluid turnover may contribute to accumulation of metabolites, and this is seen in the process of aging and in the neurodegenerative diseases. The composition of cerebrospinal fluid is strictly regulated, and any variation can be useful for diagnostic purposes. Then coming to formation of the cerebrospinal fluid. Cerebrospinal fluid is formed within the ventricles by specialized structures called choroid plexus. Within the central nervous system are cavities. These cavities are called ventricles. Cerebrospinal fluid is formed within the ventricles. These ventricles are 4 in number. That is, 2 are lateral ventricles, and then we have third ventricle and the fourth ventricle. What are ventricles composed of? These ventricles are composed of specialized structures which are called as choroid plexus. These choroidal plexes are present on the inner lining of the ventricles. What exactly is choroid plexus? Choroid plexus is a secretory unit which secretes cerebrospinal fluid. This secretory unit is a branching network of capillary projections coming from the modified ependymal cells. What are ependymal cells? Ependymal cells are the type of glial cells. There are 5 types of glial cells, that is Schwann cells, oligodendrocytes, microglia, ependymal cells, and the astrocytes. Each cell has separate function. Ependymal cells are actually cuboidal epithelial cells which are covered by pia mater. What is pia mater? Actually, brain and spinal cord are covered by 3 membranous layers called meninges. These 3 layers from superficial part to deeper part are called as dura mater, arachnoid mater, and the pia mater. That is, outermost layer is dura mater and innermost layer is pia mater, and intermediate is arachnoid mater. About 2/3 of the cerebrospinal fluid is formed in 4 ventricles, and a small amount of CSF comes from brain itself. All the cells covering the choroid plexus are specialized cells. They have special pumps for sodium. They actively transport sodium from cells into ventricular area. This is followed by passive entry of chloride. In this way, sodium chloride is formed. Thus, osmotic pressure is increased. This pulls water in the ventricular area. In this way, cerebrospinal fluid is formed. In other words, there is an electrical potential difference that pulls sodium, chloride, bicarbonate ion from plasma into cerebrospinal fluid, creating an osmotic gradient which pulls water into the CSF. Then circulation of the cerebrospinal fluid. Cerebrospinal fluid is mainly formed in choroid plexus of the lateral ventricles. Cerebrospinal fluid passes from the lateral ventricles to third ventricle through intraventricular foramen called foramen of Monro. From third ventricle, CSF passes to the fourth ventricle through cerebral aqueduct. The circulation is aided by arterial pulsation of choroid plexus. From the fourth ventricle, cerebrospinal fluid passes to the subarachnoid space around the brain and spinal cord through the foramen of Makhdoom and foramen of Rashka. Then cerebrospinal fluid leak is a condition in which cerebrospinal fluid escape from the subarachnoid space through the hole in the surrounding dura. If loss of CSF is great, it causes spontaneous intracranial hypotension. Spontaneous intracranial hypotension often causes positional headache due to downward displacement of the brain. Posterior neck stiffness, nausea, and vomiting are common symptoms of cerebrospinal fluid leak. Then coming to properties of the cerebrospinal fluid. The total volume of cerebrospinal fluid in adults is about 150 ml. That is about 125 ml of CSF is present in the subarachnoid spaces and 25 ml is found in the ventricles. The rate of formation of CSF is approximately 0.3 ml per minute. So daily formation of CSF is about 400 to 600 ml. The constant formation of cerebrospinal fluid contributes to complete removal of cerebrospinal fluid 4 times during 24 hours. Specific gravity of CSF is 1.005 and reaction of CSF is alkaline, that is pH is about 7.35 to 7.45. Then coming to composition of the cerebrospinal fluid. Cerebrospinal fluid is composed of water and the solids. About 99.13% is water and solids are about 0.87%. Solids includes organic substances and the inorganic substances. Organic substances includes proteins, amino acids, sugar, cholesterol, urea, uric acid, creatinine, and lactic acid. And inorganic substances include sodium, calcium, potassium, magnesium, chloride, phosphate, bicarbonate, and sulfates. As cerebrospinal fluid is part of extracellular fluid, therefore it contains more amount of sodium than potassium. It contains some lymphocytes. CSF is secreted by ventricles, does not contain any cell. CSF secreted by ventricles does not contain any cell. The lymphocytes are added when it flows in the spinal cord. As there is no appreciable barrier between the cerebrospinal fluid and the extracellular spaces of the brain, therefore blood CSF barrier also serves to regulate the environment of the brain. Large substances such as cells, proteins, glucose are not allowed passage, whereas ions and small molecules like vitamins, nutrients can pass into CSF relatively easy. Substances that may not pass through the blood CSF barrier, but needed by brain are either actively synthesized or actively transported through choroid plex epithelial cells into the cerebrospinal fluid. When CSF is compared with plasma, cerebrospinal fluid has higher concentration of sodium, chloride, magnesium, but low concentration of potassium and calcium. Unlike plasma, CSF has only traces of cells, proteins, and immunoglobulins. No cell can pass through the blood CSF barrier, although small number of WBCs are usually introduced to CSF indirectly when it flows in the spinal cord. Then coming to functions of the cerebrospinal fluid. As far as the functions of cerebrospinal fluid are concerned, cerebrospinal fluid provides hydromechanical protection of neuroaxis in two ways. Cerebrospinal fluid provides hydrochemical protection to neuroaxis in two ways. That is, in first, cerebrospinal fluid acts as shock absorber and cushioning brain against the skull. And secondly, cerebrospinal fluid allows the brain to become buoyant, reducing the effective weight of brain from its normal weight of 1500 grams to much lesser, to about 50 grams. Cerebrospinal fluid also maintains homeostasis of the interstitial fluid of brain. A stable environment for brain parenchyma is imperative for maintaining normal neural function. Cerebrospinal fluid provides nourishment to brain. Substrate needed for brain are transported from blood through choroidal plexus into cerebrospinal fluid, then diffuses in the extracellular space of brain for transportation to its site of action in the brain. Another function of the cerebrospinal fluid is CSF assists in the removal of metabolic waste products such as peroxidation products, glycosylated proteins, excesses of the neurotransmitters, debris from the linings of the ventricles, bacteria, viruses, and unnecessary molecules. Accumulation of such unnecessary molecules are seen in the process of aging and in some neurodegenerative diseases. This is all about the functions of the cerebrospinal fluid. Then cerebrospinal fluid analysis. It is an important tool to diagnose medical disorders that affect brain, spinal cord, and meninges. Some conditions are infections like meningitis, cerebrospinal fluid. Analysis is used for the diagnosis of meningitis, encephalitis, in brain abscess, tumors of the brain, spinal cord, or meninges, hemorrhage in brain and spinal cord, and in demyelinating disease like multiple sclerosis. Then meningitis meningitis is a medical emergency. Meningitis is a condition in which coverings of the brain become inflamed. There are two classes of meningitis: aseptic meningitis and the bacterial meningitis. Aseptic meningitis results from the agents such as fungi, medication, cancer, metastasis, viruses that cause majority of aseptic meningitis. Bacterial meningitis has much lower incidence than aseptic meningitis. But bacterial meningitis is a more serious condition. However, the incidence of bacterial meningitis has substantially dropped due to routine vaccination. So meningitis can be life-threatening because of inflammation of the proximity to the brain and the spinal cord. Classic signs and the symptoms of the meningitis are headache, neck rigidity, fever. Headache in adults, a severe headache is most common symptom of the meningitis. Neck stiffness, inability to flex the neck forward passively due to increased neck muscle tone and stiffness, and sudden high fever. So classic sign and symptoms of the meningitis are the headache, neck rigidity, and sudden high fever. All these are the classic signs and the symptoms of the meningitis. Then, where from the sample of the cerebrospinal fluid collected? Collection of the cerebrospinal fluid. Cerebrospinal fluid is normally obtained from the lumbar region, although a physician may occasionally request analysis of fluid obtained during surgery from cervical region or from the cisternae or from the ventricles of the brain. In the process of lumbar puncture, physician thoroughly cleans the skin of lumbar region and needle is introduced into subarachnoid space in lumbar region between third and the fourth lumbar spine. So, needle is introduced in the third and the fourth lumbar spine for the collection of the sample of cerebrospinal fluid. So, for collection of cerebrospinal fluid, spinal needle of about 22 gauge or 9 centimeter long is introduced in the spinal canal between third and the fourth lumbar vertebrae. And then allows 3 to 4 ml of fluid to drip into plain tubes. Because the initial specimen may be contaminated by tissue debris or skin bacteria, therefore, first tube is used for chemical analysis, and the second tube is used for the microbiological test, and third tube is used for microscopic or cytological examinations. The same procedure is used for infant and children. But the volume of fluid withdrawn should be minimum for the requested test. Up to 20 ml of spinal fluid can be safely removed from an adult, although this amount is not usually required. Then, significance of the lumbar puncture. Lumbar puncture is used for the diagnostic purposes, for the therapeutic purposes, and for the anesthetic purposes. CSF lumbar puncture is used for the diagnosis of meningitis, encephalitis, and multiple sclerosis. In therapeutic use, lumbar puncture is used to administer chemotherapic medications, or it is used to relieve increased intracranial pressure, or lumbar puncture is used to measure cerebrospinal fluid pressure. In the anesthetic use, lumbar puncture is used for epidural anesthesia in cesarean sections, and it is used for pain relief during the labor. This is significance of the lumbar puncture. Lumbar puncture is used for diagnostic purposes, for therapeutic, and for the anesthetic purposes. Then lumbar cerebrospinal fluid pressure. Physician, while collecting the sample of CSF, he first measure the lumbar CSF pressure with manometer. Normal opening pressure in adults is between 70 to 180 mm of water, and lumbar CSF pressure in children is 10 to 100 mm of water. Cerebrospinal fluid pressure rises in tumors of brain, spinal cord, and meninges. Moderate increase in the cerebrospinal fluid opening pressure is seen in the meningitis. So, the normal CSF pressure in adults, it is 70 to 180, and in children, it is 10 to 100 mm of water, but increase in the cerebrospinal fluid opening pressure is seen in the tumors of brain and in meningitis. Then sample of CSF may be analyzed by different ways. CSF sample is analyzed for physical examination, in which we see the general appearance and the color of cerebrospinal fluid. In the chemical examination of CSF is done to estimate glucose, proteins, lactate, and chloride in the CSF. The microscopic examination is done to see presence of neutrophil, lymphocytes, WBCs, and red blood cells in the CSF. Sample of CSF is also used for bacterial culture and cytological examination. The gross appearance of the cerebrospinal fluid is helpful in the diagnosis of many diseases. The normal color and the appearance of CSF is clear. CSF normally it is clear, transparent, and colorless fluid. Hazy, thick, and turbid appearance of the cerebrospinal fluid is seen in the meningitis and tumors of brain spinal cord and meninges. Red and clear appearance of the CSF is seen in the recent brain hemorrhage. Yellow appearance of the CSF is observed in the old hemorrhage. Now CSF contains glucose, protein, chloride, lactic acid. Normal concentration of glucose in the CSF, it is about 45 to 70 milligram percent or 40 to 70 milligrams per deciliter. Concentration of proteins in the CSF is normally about 10 to 30 milligram percent. And concentration of chloride in the CSF is 120 to 130 milliequivalents per liter. This is normal concentration of glucose, protein, and chloride. Normal concentration of glucose is 45 to 70 milligrams percent. Normal concentration of proteins in the CSF is 10 to 30 milligram percent. And normal concentration of chloride is 120 to 130 milliequivalents per liter. Now, concentration of glucose in the CSF, as we told you, it ranges from 45 to 70 milligrams per deciliter, which is lower than the plasma glucose. Normal plasma glucose level is, we know it is fast in the fasting level, it is 80 to 100 milligrams per deciliter, and in random condition, glucose level is 100 to 120 milligrams per deciliter. And this glucose level in the CSF, it is lower than the plasma glucose. Hence, glucose is always done estimation of glucose along with CSF. Estimation of plasma glucose along with CSF glucose is always done to avoid misinterpretation due to change in plasma glucose. Elevated level of glucose in CSF are seen in the diabetes mellitus. Decreased concentration of glucose in the cerebrospinal fluid is seen in tuberculosis, fungal infections, bacterial meningitis, and meningeal dissemination of tumors. And in these conditions, glucose level is decreased because glucose is consumed by bacteria, leukocytes, and the tumor cells. In bacterial meningitis, glucose level is far lower than the plasma glucose because this glucose is metabolized by the bacteria. CSF proteins. Protein concentration of cerebrospinal fluid ranges from 10 to 30 milligrams per deciliter, out of which 20 milligrams per deciliter is albumin and globulin is about 5 to 10 milligrams per deciliter. Albumin makes approximately two-thirds of the total proteins. Albumin makes approximately two-thirds of the total proteins because more than 80% of the cerebrospinal fluid proteins originate from the ultrafiltration of plasma, and the remainder is from intrathecal synthesis. Therefore, lowest concentration of total proteins and small proportion of larger protein molecules are seen in the ventricular fluid. But as cerebrospinal fluid passes down to lumbar spine, which is site for specimen collection, the concentration of protein increases. In the ventricular fluid, total protein is approximately 5 to 15 milligrams per deciliter. In the ventricular fluid, total protein is only 5 to 15 milligrams per deciliter. In the cisternal fluid, total protein concentration is from 15 to 25 milligrams per deciliter. But in lumbar fluid, total protein concentration increases to 15 to 30 milligrams per deciliter. Cerebrospinal fluid from the premature and full-term neonates, the level of proteins are considerably higher. CSF from the premature and full-term neonates has about up to 130 milligrams per deciliter of proteins. Because cerebrospinal fluid is mainly an ultrafiltrate of plasma, therefore low molecular weight plasma proteins such as prealbumin, albumin normally predominates. No protein with molecular weight greater than that of IgG is present in sufficient amount in cerebrospinal fluid. In all bacterial infections of meninges, that is, in bacterial meningitis, viral meningitis, encephalitis, or poliomyelitis, all are associated with inflammation, thus increased permeability of proteins. A striking elevation of cerebrospinal fluid proteins is seen in the bacterial meningitis. And in such cases, in the bacterial meningitis, the neutrophil count is also increased. Similar elevation of protein concentration in the CSF is seen in viral infections with abundant mononuclear cells. In brain tumors, the albumin level is raised, but cell count is normal. Why elevated CSF proteins is seen in the meningitis and in the tumors? Elevated CSF proteins in the meningitis is due to increased permeability of blood CSF barrier to proteins. And this is due to inflammation of meninges. In brain tumor, there is increased intracranial pressure that results in the increased permeability of blood CSF barrier for proteins. Other reasons for elevated CSF proteins in the meningitis and tumor are due to decreased resorption and mechanical obstruction of cerebrospinal fluid flow. Then electrophoresis of cerebrospinal fluid. The normal pattern of cerebrospinal fluid proteins on electrophoresis shows that albumin is 60%, gamma globulins are 8%, and other globulins are 32%. Increased IgG, increased immunoglobulins, particularly IgG is of great importance in the diagnosis of demyelinating diseases of the central nervous system, especially in the multiple sclerosis. Increased immunoglobulins, particularly IgG, is of great importance in the diagnosis of multiple sclerosis. The B lymphocytes that infiltrate the lesions synthesize IgG and other immunoglobulins. Although total protein concentration is slightly increased, but there is increased local synthesis of IgG, and the ratio of IgG to albumin is increased from 10% to as much as 50%. Then cerebrospinal fluid lactate is used mainly to differentiate between viral meningitis from bacterial and fungal meningitis. Normal CSF lactate is less than 35 milligrams per deciliter. In bacterial meningitis, there is increase in the CSF lactate, but no significant change in the CSF lactate is seen in the viral meningitis. Cerebrospinal fluid in tuberculosis meningitis reflects a decline in the chloride values. Normal chloride value is 120 to 130 milliequivalents per liter. Mild to moderate decrease in the CSF chloride is practically a constant feature of all inflammatory conditions of the cerebrospinal nervous system. Decrease in the CSF chloride is greatest in the tubercle meningitis. Then coming to composition of cerebrospinal fluid in health and disease states. Under normal conditions, CSF appears clear, colorless, and proteins in the CSF under normal condition is about 10 to 30 milligrams per deciliter. Sugar or glucose is 50 to 70 milligrams per deciliter, and coagulation is not seen. But in bacterial meningitis, this is important to note, in bacterial meningitis, the appearance of CSF is turbid due to high contents of cells, and there is marked increase in the polymorphs. That is, there is marked increase in the neutrophils. Proteins are markedly increased. Also, proteins are markedly increased. Glucose is markedly decreased, and clots can be seen on staining. In the tuberculous meningitis, the appearance of CSF is opalescent, and there is presence of lymphocytes and mononuclear cells. The cerebrospinal fluid proteins are increased, but they are not markedly increased as in case of bacterial meningitis. CSF glucose is decreased, but CSF glucose is not very much decreased, and cobweb like cobweb type coagulation is seen. In viral infections, appearance of CSF is clear colorless, cell count is increased, proteins are also increased, but CSF glucose is normal and coagulation is not seen. In brain tumors, appearance of CSF is clear, colorless, cell count is within normal range, proteins are increased, and CSF glucose is decreased. In subarachnoid hemorrhage, blood is stained in fresh hemorrhage. Cell count shows red blood cell and WBCs, and increased proteins with no significant change in sugar, and no coagulation is seen. Then microscopic examination, there is increased neutrophils are seen on microscopic examination in the CSF, in bacterial meningitis, and in cerebral abscess. Increased lymphocytes in the CSF are seen in the tubercle meningitis. Red blood cells in the CSF are seen on microscopic examination in brain hemorrhage, and microorganisms are observed in the meningitis. Bacterial culture of CSF and cytological examinations are also important tools for the diagnosis. This is all about the cerebrospinal fluid composition.